Lovely. Well, thank you all very much. Thanks particularly to Professors Bundy and Hotez for that fascinating introduction. It's lucky, isn't it? If, like me, you heard the conversation between EJ and Professor Hotez, it's lucky that EJ was saying what a great panel we have coming up, as opposed to you can leave now because it's not going to be very good. No, it is a great panel coming up, and it's a panel where we're going to talk about some of the issues that Don and Peter were discussing in the first session, and we're going to talk about some of the ways that COVID-19 has changed how the world responds to pandemics. And so my guests for this session, you can see on screen with us here, are Arnaud Bernaert, who's the head of health at the World Economic Forum, and is joining us from Geneva. Isabelle Deschamps, who is the head of public affairs at Sanofi Pasteur, one of the world's foremost vaccine producers, who's joining us from France. Pascal Barollier, who's the head of external affairs and a number of other areas at Gavi, the Vaccine Alliance, and he's joining us from Geneva. And Dan Irvine from World Vision International, who's the head of health programs at World Vision International, also has a responsibility for health and nutrition programs, I should say, and has responsibility for public engagement. Poor Dan is having some video problems with us. So if you see Dan looking confused, it's not necessarily what's being said, it's that his technology is acting up a bit today. So if I may, I'd like to start, because I think we had such a good long discussion after the keynotes. What I'd like to do is start by asking how the COVID pandemic has affected all of your organizations, and how you see it transforming the way you respond to future pandemics and future health emergencies. Arnaud, maybe I could start with you and talk about how the World Economic Forum, which many people know because of Davos, but has a much wider range of activities, how the World Economic Forum has changed because of the pandemic.
Yeah, actually, Mark, I mean, we were in Davos on the 20th of January when those cases were reported back to early 2000, and it started to be a worry. And I remember at that point in time, we had people in our attendance like Jeremy Farrar or Richard Hatchett from CEPI, or Stéphane Bancel from Moderna. And we got them into a press briefing, a media briefing, and they were very worried. And they were right to be worried. The forum was engaged into epidemics preparedness and readiness well before, because back to end of 2014, early 2015, we started to explore mechanisms that could accelerate pandemics response. This was on the Ebola crisis. For the fall of 2016, we were in CEPI, which is an organization we launched in 2017 in Davos. We're very proud of what CEPI has done in the current period. We're very, we are absolutely impressed with what you guys have done, Pascal, at Gavi, with Sven, and the way CEPI and Gavi collectively enabled COVAX, which was first of its kind instrument. And we hope that COVAX will be very successful ultimately. The way we have been engaged is because we create our COVID action platform. We ultimately became part of the ACT Facilitation Council, which supports COVAX amongst other streams of work. We are one of 4 organizations, together with the Wellcome Trust, the World Bank, and the Gates Foundation, involved in the Facilitation Council. So I can tell you we had to reshape everything and anything in our program in support of pandemics response. I can be more specific with examples moving forward, but I don't want to speak for too long at the very moment. Over to you, Mark.
You're on mute, Mark.
I'm sorry. Thank you very much. Dan, I know World Vision has also been really part of the ACT-A response, part of many other global responses, but how do you think the pandemic has changed your organization and the way you prioritize and involve the vast resources of World Vision?
Thanks, Mark. I hope you can hear me and my voice is coming in at the right time. First of all, to say World Vision International responded quite quickly to the pandemic. By March of 2020, we had established our response plan for engagement in 70 countries with a goal of providing assistance to 72 million people. And by May, one thing I'd like to emphasize is we were surveying the situations people were experiencing as a result of the pandemic across countries and regions. And by May, we were already seeing incredibly significant impacts on people's lives in terms of their decreasing livelihood ability, the economic impact, and then subsequently inabilities to access food. We began to see the rising food insecurity situation, children out of school, and very importantly, immediate disruptions to health systems. And I'd like to point out as a benchmark, the Global Fund's analysis of system disruption, 56% of malaria systems disrupted, 75% of tuberculosis services disrupted, 72% of HIV services disrupted. And we've just launched a report this week on a survey in 6 countries we've done around children's mental health. And we find 57% of children in these countries reporting significant mental health psychosocial issues, 12% of them at an extreme level. And given more time, I would talk about the complexity of that, but it's a real and lasting complexity of the pandemic situation that we're in.
Thanks, Dan. And it actually picks up on something that was on one of yesterday's panels. Some of our participants will have seen a panel yesterday moderated by Lala Tapanica, where as an Indian, she was speaking to Peter Pujari, a Tanzanian, about how you balance the need to prevent infections from the pandemic with the harm that the lockdowns do to populations living hand to mouth. And I think you've really illustrated that in what you've talked about. So, Isabelle, from a different perspective, here you are working in a big R&D organization that is also a provider of childhood vaccines. How has it affected your work and how has it changed the way you will be going forward?
Yes, thank you, Mark. It's true that, of course, vaccinating the world is a colossal task, and in general, vaccine manufacturers, not talking about only Sanofi, but vaccine manufacturers are scaling up from 0 to billions of doses in record time, and overall tripling the previous annual vaccine delivery over 2021. Pre-COVID, the global vaccine production was estimated to be around 5 billion doses for all vaccines. And this year, the production of COVID-19 vaccine alone is estimated to reach almost 10 billion. So it's just to give you the global magnitude. Sanofi is engaged in highly collaborative ways with 2 vaccine candidates that are currently in development, as well as in industrial cooperations to support manufacture of doses. So regarding the 2 vaccine candidates that are currently in development, the first one is utilizing our cell-based recombinant baculovirus platform together with GSK pandemic adjuvant, and this one is expected to deliver doses by the end of this year. The second vaccine candidate that we are currently developing is in partnership with Translate Bio, the US biotech, using messenger RNA technology. And in addition to those 2 programs that remains our main focus, of course, we are also lending our manufacturing support to other manufacturers to help addressing this global and huge COVID-19 vaccine demand. And we support BioNTech by providing access to our established infrastructure and expertise in Frankfurt, and doses should start coming out of the sites from this summer. We're supporting Johnson COVID-19 vaccine in our facilities in France, in Marcy-l'Étoile, and doses will be available from Q3. And you saw that probably this week. We also announced that we will help Moderna manufacturing their mRNA vaccines from one of our sites in the US from September this year. So Mark, as any other organization, I would say that the pandemic affected all our collaborators, our organization overall in many ways at all levels, but let's say also in a positive manner in terms of collaborations. It's something we've never seen before.
And you make it sound so normal, but for people who may not know, when you talk about Sanofi and GSK collaborating, I mean, clearly both grown-up big companies, but it's a bit like saying Pepsi and Coke got together to produce a product. I mean, these are the two great vaccine producers. So it's really remarkable. Pascal, I mean, I realize in 2 minutes I can't possibly ask you what COVID has done to Gavi. But maybe you can give us some of the highlights of the response and the COVAX initiative, which I know is hosted at Gavi and which you've been integral to.
Yes, thank you, Mark. So like everybody here in attendance, it has pushed us into remote working. And so we've jumped into remote working on the 13th of March, and we've never been back to the office. So if anything, it has shown that we were ready for that, and we've continued to deliver. And since we've gone into remote working, we've probably grown by 20% in terms of staff due to the fact that COVAX was launched. So as you said, COVAX was launched. The idea was first discussed actually at WEF in January between Richard Hatchett and Seth Berkeley from Gavi and a few others, but the idea had been really brewing for longer than that. As we had been saying for years that the pandemic was long overdue, and you may remember a TED talk that Bill Gates and Seth 3 or 4 years ago, talking about the probability that we would be hit by a pandemic. And this actually happened. We had a kind of a rehearsal for that with the Ebola outbreak in 14, 15, where we had to quickly come together, support the development of the late stage development of an existing vaccine and then rolling it out. This was kind of a mini training for what has happened last year. And indeed, Gavi was created in 2000 to answer a problem of poor countries not getting existing vaccines and new vaccines that were being developed in the richer countries. And COVAX, hosted by Gavi, but also with CEPI and WHO and other implementing partners, comes from the exact same angle that if we don't create an entity, there won't be doses for developing countries. So, I'll start with positive news, but later in the conversation, I will come back with a more reality assessment of the situation. I think the positive news is that in less than 300 days, we went from not having a vaccine to having several. In a year, we put together the largest multilateral effort ever, at least in the 21st century, bringing together 191 countries and economies. And we've fundraised more than $7 billion to pay for vaccines. So we are aiming for more than 2 billion doses of vaccines.
Which is the good news. As you said, we'll hear the less good news a bit later on. I want to come on to talk about how likely it is these changes will last. But just before we do that, I want to put a question to you that's come in from a distinguished participant in the group, Dr. François Bompard, who I'm sure all of you know, asked a question that I think Isabelle and Pascal, you may be particularly well equipped to respond to. He's asked, do you expect COVID-19 vaccine production to be at the expense of other vaccine productions? So do you expect a decreased demand for the vaccines we used to have, the 5 billion you were talking about, Isabelle, because of the scaling up of COVID production? Do you want to start on that? And I'll ask Pascal to come in a second.
Yes, sure. Thank you, Mark. Hello, François. Long time no see. Indeed, and I will answer for Sanofi Pasteur in terms of what we see in terms of demand of vaccine and how also we have managed to respond and prepare the response to COVID-19 without impacting our ability to produce routine vaccination programs. So first, on the demand, what we see is that, yes, there was interruptions in something vaccination programs in many countries. I mean, Gavi made that estimation that there are probably something around 13 million of people that will have a lack of vaccination or interruption in their vaccination during the pandemic. And in a study that will be published this month, and that was done in collaboration with the London School and Sanofi, in 19 countries in Southeast Asia, we've demonstrated that all of the countries were affected by the interruption at one point of time in their routine vaccination program, and all antigens are impacted. So countries have implemented solutions to go back to vaccination coverage, not everywhere yet, and each time there is a lockdown, you go back again in implementing creative solutions that could be, for example, separating vaccination groups from unwell patients, or that can be providing immunization services at home instead of having vaccination points. A lot of communication campaigns also on TV and social media to explain the importance of maintaining the routine vaccination. On our side, as a manufacturer, we have done two things. One thing is that we have completely changed the way we engage with healthcare professionals, moving completely virtually. We didn't stop engaging with healthcare providers, and I think that's the same for all the manufacturers, but we moved everything to virtual communication and contact. Second is that in terms of production, everything we've done and everything we are doing to develop COVID-19 vaccines is seriously thought and planned with no impact on our ability to produce vaccines that are essential for routine immunization program. So it's overcapacity that was created instead of using existing capacities and stopping polio, pertussis, Hib vaccines that are essential for the countries. Now, producing vaccine is one thing. They need to reach the people who need them in the countries, and this is where governments and healthcare providers need to put in place solutions to make sure that they can go back to adequate vaccination coverage in order to avoid resurgence of diseases.
That we don't have those children. Pascal, I think that's the point at which you might want to jump in about how catch-up is going to happen and what the potential dangers are.
So definitely, I would confirm what Isabelle has said in terms of supply. We haven't seen a drop in supply. We have seen an issue in rolling out the routine immunization campaigns because of the impact of COVID-19 on health systems. So that has been an issue, and we know coverage is taking a hit. We also know, and that is also the learning from working with countries, helping them with COVID-19 and rolling out COVAX vaccines, is that we are also benefiting from the strengthening of the systems, and the systems that we are putting in place to roll out COVID-19 vaccines are benefiting the countries for the longer term because we are putting in place systems that are probably broader, deeper, stronger, dealing with adult populations that we didn't used to cover as part of the typical routine immunization programs that were mostly targeting children and adolescents.
Great. Thank you. So I think we've addressed Dr. Bompart's question well there. It's disappeared from my chat. I'm not sure if it's still in yours, but there was a very helpful link from Abby at World Vision to the report that Dan was talking about. So if it has disappeared from everybody else's, maybe Abby, you could repost it. If it's just from mine, ignore me. Let's talk about the lasting changes if we can. So how much are these short-term changes we've seen going to change the world going forward? Dan, may I come to you on this? I know you think that there will be a change, particularly in the way that the private sector is involved, in the way that pandemic preparedness affects other issues. Do you want to briefly touch on that for us?
Yeah, I'm happy to, Mark. Thank you. And I think it's building on comments offered by Isabelle and Pascal just now in terms of the very positive kinds of changes in systems that we're seeing. Isabelle was talking about real meaningful collaboration within the pharmaceutical industry, but there's that collaboration also on a public-private sense with government, collaborations between pharmaceutical development agencies and manufacturers, and really innovations all across the supply chain that we're seeing where people are working all out to make improvements, system improvements, from development and manufacture on through distribution and dispensation on the ground. And as Pascal was just saying, I think those are going to be lasting changes that strengthen our global systems forever moving forward. So collaboration, very positive. Technological advances, very positive. I mean, what we're experiencing with the mRNA technology is going to just further be evolved and applied to other medical issues, including other viruses that we'll experience in the future, but other issues like cancer applications. And I think it's extremely exciting. We see at a political level globally, the World Health Organization has commissioned an independent review panel to review and make recommendations to strengthen the international health regulations. And I think that there are going to be some very interesting evolutions there in terms of more multilateral authority, if you will, to regulate a pandemic outbreak early on and try to mobilize action more quickly and in a more efficient way. So that's another example of real positive and lasting movement. And multilateralism, as my colleagues have been talking about also, I mean, the event of the establishment of the COVAX facility in particular for me is just incredible. The rapidity, the quickness with which it was established. And it's been a learning exercise moving forward. I mean, there were a lot of assumptions built into it. It's built on a lot of goodwill with bilateral donors and participating countries. And it has had its share of challenges, but it has put forward a multilateral model, I think, which we are all going to work on to perfect moving forward. And in future similar situations, I think it's going to work even better than it has in this case. On the flip side, I just want to say quickly also that in terms of the pandemic impacts on human development all across the world, as I was alluding to earlier, I think there are a lot of real serious questions in terms of how the world chooses to invest in recovery across multi-sectoral issues, the health setbacks that we've seen, and that we were just talking about the interruptions in immunization. The World Health Organization and UNICEF have stated that a child born into this period has less than a 20% probability of receiving all of their routine immunizations by the age of 5. You know, we really need to get on top of that. We've got incredible malnutrition increases, a 7% increase in severe acute malnutrition globally, doubling of global hunger, you know, a lot of setbacks that are going to take us time to recover from and catch up on. And the question becomes for donor countries, are they ready to take that on? Are they ready to invest in ways that are going to recover and accelerate progress again, even beyond where we were before the pandemic? So these are big questions.
They're very big questions, and yesterday I moderated a panel on this, which wasn't full of hope, to say, about the willingness. I mean, Arnaud, let me come to you on this. Number one, you look at it at a macroeconomic level. What do you see as the willingness of donors? And then number two, Dan said we've learned a lot from ACT-A, which, as you've mentioned, grew out of discussions at Davos in early 2020. What do you see happening with the evolution of CEPI and HERA and other moves? And tell us what those are, because I've badly used the.
And I think very good remarks have been made before by Pascal and Dan when it comes to the lasting changes, and I think I'm also very hopeful that we will see that the investments being made by ACT-A in infrastructure for vaccines delivery will serve in the long run, including when it comes to routine vaccination, including, frankly speaking, influenza. So that's something that is a permanent feature, I hope, that will be maintained. COVAX, an advanced purchase commitment facility, has become an instrument that is so essential. It gets to 2 billion doses, but we know we need so many more billion doses. There's still a large funding gap. So I think let's not stop halfway, and let's continue to make that call to solidarity to the more wealthy nations. And the point that was made about IHRs and the way they are outdated in context where we need to reopen the world and the economy, and we need to understand what this is going to mean to our vaccination certificates, and how is this going to be adjusted in IHR regulations, are all open questions. But I think my two hopes is that we can progress, point number one, a very large effort to enable a pandemic's genomic surveillance network in support of WHO. And I think vaccines manufacturers have to take part of that, because, you know, the hidden truth in a way is that there is a $150 billion market that has emerged for COVID vaccine in a period of 1 year. And for me, a call to solidarity and responsibility from businesses would mean that vaccines manufacturers need to invest into genomic surveillance, not only for perfecting the boosters, but also for doing that in a pre-competitive fashion where they share all the sequences of the biolabs networks they enable, and they offer that as a public good to WHO for WHO to manage. I think this is a very area of focus.
Sorry to interrupt you, Arnaud. Just for everybody who doesn't know, we should probably explain that the purpose, or at least one of the purposes of this genomic monitoring, is to look for variants, to look for evolution of this virus or of other viruses in a way they might become more dangerous or more transmissible.
Yeah, that's correct. But I think this network, if it's going to be enabled, and I hope it's going to be enabled with the like of WHO, Rockefeller, Rick Bright has moved from BARDA to Rockefeller to precisely lead an effort of that magnitude in support of WHO. I think this is also for ignored pathogens and pathogens that will emerge moving forward in future crises. And also having very inspired by the CEPI 2.0 strategic vision that is about, listen, there is not enough manufacturing capacity on the planet, and it is generally so located in regions and countries where vaccines nationalism will will prevail, and those vaccines will be trapped in geographies and will never reach the less wealthy countries. So a vision from CEPI is, can we enable a vaccine manufacturing network, largely so based on mRNA, new technologies, and build that in countries of a small population and enable them in a network where vaccines can be innovated against prototype pathogens in classes of virus where we actually have nothing, and there are 15 of them where we have really nothing. So I think those two instruments, I think, needs to emerge. Genomic surveillance, CEPI 2.0, CEPI will raise 3.5 billion in support of that manufacturing vision in the current period, and we will stand very, very strongly behind their efforts in the fundraising moment.
Great, thanks, Arnaud. And for anybody who doesn't know, we keep talking about CEPI. CEPI is, of course, the mission that was formed at the WEF again to prepare for pandemics and to fund research and early manufacture research. Pascal, may I come to you for a second? Can we have an update on COVAX? I mean, you gave us the good news earlier. Arnaud has said it. I think you'd agree, it's not enough. More money is needed, more speed. Can you give us a bit of a prognosis for COVAX over the rest of the year? I think we might have a technical problem there. Have we lost Pascal? Great, I'll ask the producers to let me know when Pascal is back. My chat box, by the way, is blank. If you have questions or comments, I'm a little late because we were a little starting because of technical problems. So not too late for you to put questions and comments into the chat box. So while we wait for Pascal to return, maybe I can pick up on something that I think, Arnaud, you mentioned. The spread of adult immunization, of flu vaccines much more globally, the future of immunization. Isabelle, this is an area where Sanofi is heavily involved. Do you see countries really taking on this effort to go beyond immunizing children?
Yeah, I think that's a great point. That's an important point, and I think that's part of the things that will probably last after the pandemic. The pandemic response today is a great momentum for adult vaccination, and overall, we all know that the healthcare systems are facing increasing pressure, and the COVID-19 pandemic came on the top of other ongoing challenges, including the demography and the inevitable aging of the population. The investment in disease prevention offer a path to sustainability, eliciting the net benefit to people, to economies, it was said. And more specifically on vaccination, the lifelong immunization is an essential ingredient for a strong and resilient health system, protecting not only the children, but protecting all ages from vaccine-preventable disease. And to support successful implementation of what is called this life course immunization, so it's adolescent, adults, elderly, vaccination all along the life, the health system should and have to expand vaccine delivery channels to include pharmacy-based vaccinations, community-based, employer-based, residential care-based, school-based delivery of vaccination. So it requires to multiply the channels for vaccine delivery. And this life course immunization will help government to deliver immunization services both during and outside the pandemic. And it's true that it was reflected by the fact that the country readiness for rollout of the COVID-19 vaccination program was significantly accelerated in countries where adult vaccination was already part of the national programs, including countries that had a performant flu vaccination program. So we think that there's a momentum for the adult vaccination, for the development of the adult vaccination. And yes, we see the demand from the countries increasing significantly, like last year, but it continuously increasing, yes.
Yeah. Dan, within countries, I mean, Isabelle is talking about the countries which had life course immunization being better prepared, but more broadly within countries, we've seen vast inequalities, haven't we? We've seen, we focus a lot on the international inequalities, and we'll hope to come back to Pascal on that. But at a national level, we see big inequalities too, right?
Oh yeah, you know, it's well anticipated to experience inequities in vaccine distribution across countries. We've fully projected it. I'd like to start perhaps by saying that the WHO SAGE Advisory Group has put forward some very good principles and recommendations for the COVID vaccine distribution from an equity perspective and standpoint, and COVAX has picked this up and has a very interesting distribution methodology that's proportion based, you know, getting 20%, I think it might be 30% now across all participating countries in terms of the vaccine coverage. And then the question of who to prioritize, and taking an epidemiological approach to that in terms of identifying who's at greatest risk, where the vulnerabilities are. And so we see most of the implementing countries now prioritizing elderly populations, prioritizing health workers. And these were recommendations from WHO early on, very good. But there is a requirement at a national level to do further epidemiological assessment of where the greatest population vulnerabilities are. And so, for example, here in the United States, we know that there's greater risk and vulnerability in the American Indian population, in the African American population, in Hispanic populations, amongst poorer wealth quintiles. And this all needs to be assessed and really come to bear on the distribution planning processes that go on, and make sure that these groups are included comprehensively and well vaccinated to really control the outbreaks and the risks. Now, we've been monitoring the national deployment vaccination planning processes. We've had the privilege of participating in the COVAX review of the African plans, for example. And we do see problems emerging in terms of representation in those planning processes of civil society, vulnerable groups, their engagement and inclusion. Not enough of that assessment of the vulnerable groups, not enough investment into the demand side of the equation, because it's also one thing to prioritize population groups in your planning. It's another to invest into the demand side requirements of getting those populations to access the vaccine distributions equitably, and to be informed about them, and to address their hesitancies, because they all have highly contextual hesitancies and trust issues. And we need to see moving forward a much more concerted investment into, one, the representation inclusion of these groups in the planning processes themselves, two, the education and awareness raising for these populations, and three, the investments into the demand side creation that's required for them to really well access this system moving forward. So there are a lot of challenges there for us moving forward.
Yeah, yeah. And on day one with Arnaud, you gave us an example. You spoke about Native American populations, gave us an example of working with the Navajo Nation. So the Navajo Nation in the US now has one of the highest immunization coverage rates, because what you were talking about, Dan, that involvement of them in planning, in scaling up. Pascal, are you back with it?
I don't see me here.
We can sort you. Shall we let it go?
Yes, if you can.
You're cutting up a little bit. Let's try it. What I'd really like is a bit of a look forward on COVAX. what you think will happen with COVID vaccine availability in Gavi eligible countries?
Yeah. So, are we happy with where we are today? Certainly not. There are a number of things that need to happen. As we know, there is about 1/3 of the high-income populations that have vaccinated or 2 doses. But when you look at low-income countries, only 10% has been vaccinated. We can deliver those, but to get active doses, we need to deliver of doses.
Pascal, we're losing you, unfortunately. I hope we got the important bit up front. Do you want to try one more time? No. Okay. I think
maybe I would like to speak on Pascal's behalf, because I think that's important. Pascal was suggesting that COVAX has raised 7 billion, remarkable accomplishment, and 2 billion doses will be hopefully delivered to COVAX countries in 2021. We think it's still highly doable, even though it took a little bit of a delay because of supply issues. Now, if that's for 20% of the population of those very nations, which means practically that COVAX has to raise another 25 billion for 8 or 10 million doses to be delivered to COVAX countries. So it doesn't stop in 2021. There is an urgent need to ramp up manufacturing capacity and fund COVAX to its full potential, which again requires another 25 billion.
Thank you, Arnaud. And I know the efforts are underway, and I know people are hopeful. I want to address 2 things in the couple of minutes we have left, but I'm going to give each of you 30 seconds to address anything I've missed. Isabelle, one thing I wanted to address with you, we talked about how strikingly fast the progress has been in getting vaccines against COVID. A part of that has been how flexible regulators have been, not less rigorous, not less concerned about safety, but willing to work cooperatively with vaccine developers. Do you see that having an impact on the future?
It's a really good point, Mark. I think one of the remarkable changes that we've seen during this pandemic is also in the domain of regulatory, as you said. Vaccines are highly regulated in pandemic and non-pandemic period. But during this pandemic, regulators have shown an unprecedented level of cooperation across agencies. Arnaud, you were talking about sharing materials, sharing sequences, etc. I mean, the collaboration across the agencies was also something very important to come to alignment in terms of requirements. And the level of cooperation across the agencies and also with manufacturers, I mean, I can maybe give 2 concrete examples that help accelerating the availability of vaccines. The first one is what we call the rolling review process by FDA, by EMA, and also by the WHO. And it means that agencies have accepted to review the efficacy and the safety of the data as they become available, not waiting for the end of the development to start looking at the data. It doesn't change the quality of the data that we have to generate and submit to an agency, but it accelerates the process of review and accelerate the process for approval. Second, maybe example I can give that creates significant difference is the harmonization of labeling for the emergency use license or the conditional approvals that are given by the regulatory authority. So giving exemptions to some requirements, for example, alleviate some of the language requirements, having a more standardized language across the packaging, across the different countries, accepting multi-dose presentation in countries where normally it's not accepted and only single dose, can be provided. So for a manufacturer, it means producing a single presentation of a vaccine that you can then allocate to different countries depending on the need and depending on how the contract evolves. So these are two concrete examples that are key conditions for first rapid availability of vaccine, and importantly gives the flexibility in the supply allocation or reallocation, as we see now more and more. And I think probably Pascal wanted to say that, is that we will see reallocation of doses from a country to another one to address where the needs are. Maybe if you give me 30 seconds more, do you have 30 seconds more for another example, Mark?
Well, actually, I'm getting increasingly frantic warnings in my ear, Isabelle. So we might have to live with those examples you gave, but they're powerful. Thank you, Dan. I want to touch with you, if I may, just on one final thing quickly. Jane Nelson on day one, Dr. Pate yesterday, talked about collaborative governance models, network governance models, where civil society, governments, private sector are involved in a joint enterprise that they manage together. How do you see those evolving? I know it's a big question, but 30 seconds if you would.
It's a very interesting question from a civil society perspective, because we don't always enjoy a very strong and constructive space in regard to some of the multilateral discussions and the governmental discussions that go on. But we're seeing positive movements with the World Health Organization, for example. Just last week, we held the first WHO non-state actor forum over the course of 3 days, allowing non-state actors to speak into the World Health Assembly draft agenda items, providing our inputs there. And we're in the process of constructing a system of non-state actor constituency statements into the Assembly on the front end of discussions to be able to influence the deliberations there better. So yeah, I think it's evolving, and it can always be improved, but we're moving in a good direction there. But I'd like to say, as a last comment, building on something Arnaud mentioned earlier, Mark, around the $25 billion for COVAX and the vaccines. And just to put it into proportion, in 2020, in my understanding, global GDP took a hit of about 4.5%, or about $4 trillion. And moving forward, it's essential that governments invest proportionately to the issues that we have to prevent these kinds of losses and really gain control of the situation. So my advocacy moving forward is very much going to be to see much higher levels of bilateral investment into the COVAX facility, into Act A, and into all the development buckets required to recover from this pandemic. And it may be a couple $100 billion over the course of the next couple of years, but that's really a small amount of money proportionately to the losses that we're facing, the economic losses and the human losses, I would say.
Absolutely. I mean, that's a very powerful note to end on. But Arnaud, I want to give you 30 seconds. Is there anything we forgot that we should bear in mind?
No, I think, Mark, I'm a born optimist, and God knows it is difficult to be a born optimist in the current, really, as we look at the terrible situation we see unfolding in India. So heartbreaking. But still, I would like to believe that the trends we had seen before the crisis, where trust in vaccines were desperately dropping, including in high-income countries, where measles crisis, re-emerging disease because of declines in vaccination trends. I think there is also a silver lining to the current crisis, is people want vaccines. People want vaccines. And the fact that the interest in vaccine has increased considerably, combined with a better infrastructure for vaccines delivery, makes me believe that post-crisis we will have better, bigger vaccination campaigns also focusing on adults, and that's going to accelerate the control of TB, hepatitis, cervical cancer, diphtheria, you name them, and hopefully before too long, malaria and HIV, when we will finally have vaccines also for those diseases. I wanted to mention that because I can't ignore that we are in the midst of the immunization week, and that's where the future resides.
A very hopeful note on which to finish. Listen, thank you. Despite all the technical challenges, we've had a marvelous. I thank Pascal in his absence. I want to thank Arnaud and Dan and Isabelle, who are here, and it's been a great discussion.